University Hospitals is one of the Transplant Game's most valued partners. And today we celebrate Living Donor Day. We'll be speaking with the leader of one of New Jersey's top liver transplant programs, Dr. Nicholas Pirsopoulos. I said that pretty good, didn't I, Doc?
Impressed.
So Dr. Pirsopoulos serves as a professor of medicine and chief of gastroenterology and hepatology at New Jersey's Medical Center, and the medical director for the liver transplantation for University Hospitals. Doc Yassas.
Yassas.
It's so good to have you with us today. Thank you so much for sitting and having a conversation.
It's a pleasure. Thank you so much for having me.
So let's get right into it, Doc. Can you tell me about the Center for Advanced Liver Disease and Transplantation at the Rutgers-affiliated University Hospital?
It's one of the oldest in the country. Dates back in the 40s when the Center for Liver Disease started. And very famous people have been treated, not only from New Jersey, but from the United States and around the world. One of them was the Sammy Davis Jr. He was one of our patients. And of course, he was treated in our institution. And in 1989, we have the addition of the liver transplant program as well. And now we have a full-blown comprehensive program, the Center for Advanced Liver Disease and Transplantation.
That's incredible.
Since then, approximately 1,570 liver transplants have been performed. And at this point, we rank almost number one in the country regarding quality, as our 1-year survival rate for the patient is approximately 99%.
Oh, that's amazing.
It's a wonderful team that it is extremely comprehensive, is a multidisciplinary. As you know, transplantation is a team sport.
Yeah.
We have to have lots of specialties like physicians taking care of the medical component, surgeons, cardiologists, infectious disease, endocrinologists. We need to have our coordinators together. We need to have financial people, social workers. So all of these people are conferring actually not only for the state, as this is the state program, but also, for people that they are coming outside the state and sometimes international. So we're really very proud.
And we're very proud of them as well, absolutely. Doc, tell us about the innovative programs that your team is doing now with the Transplant Center.
It is excellent that we have the opportunity to embark on research opportunities within the liver transplant program. As you know, there is a shortage of organs at this point. There are approximately 13,000 people waiting for a liver, for example, but only 6,000 to 7,000 will be transplanted this year. And sometimes we have organs that they are not optimal. So one of the innovative programs we have is a machine, a perfusion machine that can maximize the potential by tuning up some organs that otherwise would have been discarded and turns them to organs that can be utilized and we can save some lives. In other words, we are able to transplant more people utilizing this kind of technology.
That's incredible.
Yes, it is. And it's not only for livers, but, can be implemented for kidneys and other organs as well.
Wow. To think that you can take something that in the past couldn't be used.
Exactly.
And you're making it almost new again.
Yes.
That's fantastic.
So more people. I have to mention that approximately 20% of the patients waiting for an organ will never be able to be transplanted as the disease is advancing. And I'm discussing about liver disease. So with this technology, we will be able to minimize the deaths while people are waiting on the list and transplant more people.
Doc, you're also you're the leader in clinical hepatology trial enrollment now. Can you tell us a bit about that and the innovations coming from that department?
Absolutely. It is true that we are a full-blown academic institution and we perform lots of research. There are trials that we are leading the world regarding enrollment right now. For example, one of the unfortunate most common liver disease nowadays is alcohol-related advanced liver disease, especially now with the COVID situation that people were not able to go out and do some other things and stayed home. So, and the mortality for advanced liver disease induced by alcohol can go up to 70, 80%. So we have some compounds that we utilize, and we can bring the mortality down to 20-30%. And at this point, work with these patients and try to direct them appropriately through the channels and bring them back to life. Everybody makes mistakes, that's okay. And we can always need to look at this issue with a positive, optimistic way. Another trial is for patients with acute on chronic liver disease. What we try to do, suddenly you have somebody who's suffering from liver disease and something else is going on at the same time, and they turn yellow, they have fluid in the abdomen, they start vomiting blood. So what we try, we exchange the plasma. In other words, we try to clean up the blood, and we are actually administering some other compounds, try to stabilize them, do the transplant evaluation, and perform transplantation.
Truly innovative.
Yes, it is. Also, we have some other trials for patients with fatty liver disease, which is the most common liver disease right now. This is the new kid on the block. And it's not only the outside, but, fat is coming in the liver as well and can induce scar tissue. So we have compounds that they can clean the scar tissue.
So, Doc, you have an incredible team that works with you. And like we just spoke, it's an incredibly innovative program that you have. I looked at your titles, and you have titles upon titles. Your business card must be two-sided. What does a day at work look for you?
Well, I'm very happy to be within this division and the department. And, we start in the morning by teaching the generations that they are coming and providing lectures to our fellows. So within the division, there are 15 fellows. In other words, 15 physicians in training that we will pass the baton at some point. And we need to train them appropriately. So in the morning, we have the morning lectures. Later on, we see patients together in the clinic by teaching them and offering excellence in patient care. After that, I'm having meetings with my research team as we need to go over the trials and monitor what's happening with this. And of course, some administrative responsibilities, try to recruit people and try to advance and mentor the faculty within the division so they will be able to move towards the next step, get promotions, get better. Also, we are organizing 2 national conferences every year. Our national conference this year will take place in Philadelphia in September. So it's a 2-day conference, and we have approximately 20 faculty.
So you share that information and that knowledge not only with your own team and hospital, but with those across the country.
Yes, actually, during the last meeting that happened to be virtual, we had approximately 900 registrations, and people from all over the world were able actually to interact and see what we are doing.
Is there that information sharing between yourselves and other countries and other physicians across the world where you banter back and forth and you exchange ideas about programs?
Yes, absolutely, especially with the trials. The trials we participate are international trials. For example, at this point, we're number 1 enroller, and number 2 is the center from Belgium, and number 3, the center from Italy. So we have the opportunity actually to participate in national conferences and exchange information and advance science, offer better care to the patients as well.
And the patients that's what it's all about. I'm very fortunate to have met so many families and donor families and recipients and living donors as well that we just get to have great conversations. And I keep saying the same thing, but it's about those conversations. It's about being able to talk to people and to share stories and enlighten them on how important, being an organ donor is and what transplantation can do for not only the people that are getting those transplants, but for the entire families and the networks and people helping people.
Yes.
If I may, what is your favorite thing about working with transplant recipients and their families?
It's amazing to see the transformation of these patients. Unfortunately, for patients with advanced liver disease, we don't have any kind of bridging therapy yet, like hemodialysis for patients with kidney disease, or the LVADs for patients with heart. So when you reach the point that that's it, it's transplantation or nothing. And try to bring them back to life and try to support the families. It's an amazing story. This changes not only their life, but our life as well. You see that we're fighting every day, try to keep them alive. And of course, I would like to express my appreciation to our organ procurement organization, the New Jersey Sharing Network, with an outstanding leader, Mr. Joe Roth, and of course, Sharon and Caroline and everybody working over there, that they're fighting along with us. Sometimes we give them a call and say, look, there is somebody over here who cannot wait. Can you do something? Can you speed up the process? And they are very compassionate and they are helping us. And of course, my utmost appreciation to the donors and their families. Mm-hmm. I remember when I was in the University of Miami, the first thing you see outside the transplant center is, heavens, don't need your organs.
Yeah, that's right. You don't take them with you.
But at the same time, you can make a difference. I'm an organ donor.
Me too. Absolutely.
So this is priceless. Having somebody who comes in ready to die, and suddenly you give them a second chance in life. You see them, they go out. They are with their families. And they compete actually in the games.
Yes.
That's why it's extremely important.
It is. Have you heard of the transplant games before they came to New Jersey?
Oh, yes. Always.
What is your take on the transplant games, and how does it resonate with you and your team?
Oh, this is so important for every single transplant center. First of all, you see sometimes your own patients participating and say, is this the person that a few years ago was in the ICU, in a bed, intubated, ready to die, and now they are competing? How much uplifting is this? Also, what a role model, what an example for everybody. This is amazing. This is a life-changing event. And it is a great situation that you have actually all of these people coming together as well and exchange stories. It's like a gathering. Do you know how much we missed it last year with the COVID situation? Of course, friends see friends at the same time. You share stories.
It's an incredible.
You grab a bite. It's a life-changing.
Yeah, so it's obviously definitely been a positive for you and your team, but I think it's also a positive for anyone who comes into contact with these games, because just like myself, before I knew anything about them, I just came in and discovered for myself. And on the first day, I realized this is different.
Yes.
The people are different. It is a family of people. It's not just like you said, we get to see each other, but it's not just people, oh, hey, how are you? It's hugs, and they understand, they have compassion for those who have gone through, because they understand themselves how vitally important it is to be an organ donor. And like you said, donor families, we could say so much about donor families, but so much love for them and the strength that they show. I had opportunity earlier this morning to speak with a donor family, and we talked about the strength that they show for those who are just going through it now. And it's something to look forward to when you're struggling at the moment right now. And when donor families show that strength, it's almost like the light. You can continue on. You can get through this, and you have a community of people and a network of people that understand you, that would sympathize with you, that would give you that shoulder when you need it.
Yes.
And take you under their wing a little bit. And this community, this Transplant Games community, and the whole Sharing Network community, it does that for us. It's incredible to think that this actually exists. We can only wish more and more people would join and be a part of it. So Doc, how does one like yourself actually get involved in this? Where is the passion? Where did it come from? It's not a typical trade that one would go into. This is something you have to go into because you actually have a passion to do this kind of thing. And not just to help somebody who hurt themselves, but to change someone's life completely.
Well, I will share a story with you. So,
Please.
I didn't want to be a liver doctor. I wanted to be a cardiologist, a heart doctor, because my father had some heart issues. And when my assignment came and I was actually allocated to the liver hospital, I was devastated. But I still remember this 39-year-old young lady with a disease that her body created, dying on me. She was bleeding, she was yellow, and her fiancé was there all the time, devastated, along with her family. This was a life-changing situation for me. I realized that these people need some help. And this is the reason, actually, that I left the country I was born, because we didn't do that many transplants. I came to the United States, tried to help people, and that's why I am doing this. I think that you need to have it in your DNA. When you try to do something like this, it is devotion. There is, of course, no schedule in your life because you get phone calls at any given time. But when you see people walking outside the hospital while they were intubated, ready to die, a few days prior to that, this is what keeps you going. It's the second chance people are getting. I'm really very happy.
We're really happy that you do what you do as well, by the way. It's so greatly appreciated. Thank you for taking the time to speak with us and to share with everyone at American Dream right now who have an opportunity to listen to our conversation. And,
it's a privilege for me to be here, and this is the reason I brought my family with me as well. Because I would like them to experience this as well. So my 16-year-old son is with me right now, and he asked me, actually. He wanted to come in because he wanted to get the experience. So this means that, this is a moving event.
It's very moving. And obviously, it's very important to see your patients participate in the games. But why do you think it's important for everyone to understand that these games, although it's wonderful to see friends and to come together as a community, why is it important for recipients to participate in games such as this?
Well, because they become the role models. And you see what transplant can do to somebody, how transplantation can transform. Not only bring people back in life, but also improve the quality of life. There are patients that are undergoing hemodialysis 3 times a week, 4 hours, another couple of hours driving back and forth. So this is a huge commitment. And the quality of life for these patients is coming back, or people that cannot breathe, they get a lung transplant. Also, there are some other people that they have some bone issues, so they can get actually tissue as well. Or some people actually cannot see very well, and they can get, the cornea. So it's not only that you bring people back in life, but you improve the quality of life for some other people. And when you see these people from not being able to walk, not being able to perform their daily activities, not being able to socialize, going out, and suddenly they're competing in the games, this is a role model situation.
It is.
And this is a moving event for everybody in the community as well, for donation as well.
Eye, tissue, organ donation, it's so important. It's so vital to sharing the gift of life, really. And it's easy to do. You can go on the Sharing Network's website. If you have an iPhone, you can get on your health app and register to be a donor there. it's so much easier now to do that. We encourage everyone to be an organ donor. It's so vitally important, and the gift of life is one that goes without saying is probably the most important gift ever. Doctor, thank you so much for stopping by, having a conversation with us. We appreciate it so much, and for everything that you do and everything that your team does on behalf of everybody.
Thank you very much. It's my pleasure. I am privileged to be here.
Dr. Chrysopoulos joining us today. More programming coming your way. Appreciate you joining us.